In your case, was it so?
Well, I didn't quite really like my first results. I wanted more, and over time, well, some people start getting obsessed also. So there's a thin fine line between, okay, you know what, oh, maybe sometimes they get botched, some clients get botched, so they need to go in again for a second round to correct what the previous surgeon did. Sometimes
Okay.
it's just craving for more.
Okay, with the negative records of plastic surgeries that we've seen people having collapsed breasts, even collapsed bum bum, bumpy skin, sometimes excessive bleeding, and irregular contours on their body. Even with the professionals we see abroad, some of these experiences also come, which happens to be like a risk. What do you think are the way forward, and why do you think people should still do plastic surgery even with all this risk?
There's complications we talk about when it comes to liposuction or plastic surgery, not risk. Few times you can have risk, but if you go to the right places with experts, not quacks, you won't talk about risk. It's complications, which as humans we try to manage. Cases like necrosis, that's maybe in the process of the surgeon trying to give you that sculpt, like they over remove fats more than, so it causes blood shot, like blood doesn't circulate or cut off oxygen to the skin, so the skin dies. Then we have sometimes excessive bleeding, which that we can manage through blood transfusion. And even for the case of excessive bleeding, that's why you have tests. We run tests prior to the surgery to know your blood count, to know, okay, if you're short of blood. Sometimes, like surgeons that know what they do, they'll tell you, oh sorry madam, you can't have your surgery done, you need to boost your blood and all that, or okay, we have to get blood on the side, in case you need blood transfusion. What else? Sometimes human error, the surgeon might take out fat more than in one area than the other.
So what about these contours and irregular itches, body itches, reactions? What are the causes for this?
Well, some people, for the reaction, some people react to even the anesthesia, which because of the poor medical record we have here in the part of the world, some people don't even know what they react to. Some people don't know. Some people react to sulfur, but because they've never really had a need to use maybe medication that contains sulfur, like some of the antibiotics, they might not know until they try it and they now start seeing like they are reacting. So if you go to the right surgeon and they administer any drug or anything to you and you start reacting or start feeling funny, once you tell your surgeon that is grilled and trained, they know what exactly to give you to reverse whatever you're going through or to curb that situation, to stop it, or they immediately take you off that medication or the drip or whatever and place you on something else. And because of experiences they've had, they will be able to relate. Oh, we once had a patient that had this, okay, so let's try this. So that's where the surgery is.
So what is post-surgical care?
Okay, post-surgical care starts immediately after your surgery. Once your surgery is done and you're wheeled out of the theater, your post-surgery phase starts from the nurses taking care of you, or rather the anesthesiologist also making sure you are stable, because like they are reversing the state of you in deep sleep, so they have to bring you back awake in your sound mind. So you might feel dizzy for a while, incoherent, they'll stabilize you, make sure your heart rate they monitor your heart rate and everything. That's left for the nurses and the doctor and the anesthesiologist. After that, few hours, or let's say the next day, that is when I come in, like the professional massage therapist comes in, and we are the one that do most of the post care, because we are it's like the surgeon hands you over to us. We do majority of the post care. So that's when your massage starts. That's lymphatic drainage. After each time you do your massage, we'll dress you, we'll help you have your bath, clean the incision sites, make you fresh, because after the surgery you need to be clean so as to avoid infections and all. So and it also has to do with wearing your compression garment religiously so as to get the desired shape. It's not just about doing surgery.
So this sounds like a job. You know, when you say this is what you do and you give this kind of explanation, a lot of female might just feel, I can take care of myself.
It's not that easy.
So if you say it's not that easy, why is it so?
You're bleeding, you're very sore, you need someone to help you at least move some things for the first 1 week. You need someone to do your massage. You obviously can't do the massage yourself. It's not something you've been through before, so you need help. You need a professional hand to assist you. You need nursing care. You need someone around to even help you with maybe running hot bath, preparing your food, helping you pick some things, because you won't be able to bend down to pick some things because you are really sore. They've really worked on your back and all that. So most times the first 1 week, most patients are kind of in bed. They are bedridden. You just want to rest, have all the sleep you can get, regain your energy and all that.
Alright, so we're having the back done now. Pushing the fluid out of the system from the back. She also had like the suction done on her back. So I'm opening up the lymph nodes now so that I can drain into it. So you see the incision holes. It was from here the fat was taken from my back. So the discomfort people feel after the surgery, the massage also helps to reduce that discomfort. The lymphatic drainage is usually home service, because after the surgery clients will go home, so I'm mobile most of the time. You just buzz me up, chat me up, reach out on Instagram. Should in case you've done your surgery abroad, let's say US, UK, and you can't stay for the 2 weeks recommended before you can be able to lie on your back or sit or lie down on your bum, you can reach me out. If you're in Nigeria, you had your surgery done somewhere else, we have had a lot of hospitals that do this now, plastic surgery clinics. If your doctor doesn't recommend lymphatic drainage for you, trust me, you really need it. It's even more, it's almost important as the surgery itself, because it's a healing process that you shouldn't ignore. And wearing of your compression belt also. You are meant to wear the compression belt for about 6 weeks or more if you can. The first week I usually recommend my clients to wear it for 24 hours, if possible 20, because you need your skin to breathe, you might want to wash it. And from the second week up to the 6th week, you can wear your compression belt for 12 hours at least.